I'm getting ready to sing like Diana Ross. I mean, that song makes me want to sing. Hi, everybody. Once again, this is Brenda Perryman. This is the Brenda Perryman Show right here on TV 33 WHPR Comcast 20 in Detroit. And with me, I have a very esteemed guest, Dr. Winfred Griffith. Good morning, Dr. Griffith.
Good morning, Brenda. How are you?
I'm just fine. I'm just fine. And you told me a story, and we're going to get to that story in
Oh
just a few
my
minutes.
goodness.
But I want to let's find out a little about you. You were born in the West Indies, correct?
I was born in Trinidad, the West Indies.
And you've been in the States since.
Whew. I've been in New York since 1964.
Wow.
My three brothers and I came up together.
Oh, you came together.
Oh,
So were
yes.
you in school at the time, or?
I was in school, and all went to school in New York. Um,
What borough?
Brooklyn, New York,
Ah,
the Big B.
Prospect Place, Sterling Place. I
Exactly.
know.
Oh,
I
you
know.
do?
Ocean
Okay.
Avenue.
That's right. That's right.
And so you went to school in Brooklyn.
Went to school in Brooklyn. Um, I'll give you a quick educational chronology. Went to school in Brooklyn, and when we came to this country, my father said, "You four boys will be going to Uncle Sam's war someday." And the youngest one was 7, the oldest one was 14, and 3 months after we came to America, my mother passed in a fire in New York.
Oh.
So we were being raised by our father, and he's mentioning this war, and we're like, what does war have to do with us? And we don't know this uncle. So, so we decided very quickly that we will band together, stay in school, and do the things that were right. My oldest brother graduated when he turned 18, and within 2 weeks, he was in the military. And at that point, we found out who Uncle Sam was.
I know.
So I remember him saying to me on his way out, "Willie, make sure you go to college so they don't draft you. You can use the same thing the white boys do to stay out of the war." And I went to college, and under a student deferment, about a week after I was finished, they came knocking on my door. And sure enough, it was the military.
After
saying
you
to me-
finished college?
After I finished college, they came knocking on my door and they said, "It's time for you to serve." And I'm like, "How did you guys know?" And they said, "Oh, we keep up with you. We keep
be
up."
knowing.
That's right, we know. So I went to the military and was a medic, loved it, came out, went to medical school.
Where did you go to medical school?
Now, I actually went back to the Caribbeans to medical school. That's where I was familiar with, and in Nevis, and it was a good medical school. I enjoyed it. I did my advanced training right here in Detroit. That's how I ended up in Detroit, actually.
Where?
Come in here to do my advanced training in the DMC.
Oh, wow. The
So,
DMC.
Yes.
That's really been talked about this morning.
Oh, yes.
And so, what was your specialty?
Internal medicine.
Oh,
Yeah.
okay.
And it's a funny story. I did not want to work with the geriatric population.
Really?
I had actually promised myself I would never work with the geriatric population.
The older people.
And a classmate of mine said to me, "My dad wants to talk to you." And I'm like, "Talk to me? What does your dad do?" He said, "He is a geriatric specialist." I said, "I don't want to talk to him." And he says he wants to talk to you about hiring you when we finish. And I went to the clinic. His name was Dr. Lackey, Lawrence Lackey. I was so impressed from the first second I met this man. But what impressed me more than anything was as I passed through the waiting room, it was filled, maybe 40 patients there.
Wow.
And these patients were orderly. They were just sitting there. They were dressed up nice. They were smelling good. They were clean. They weren't, with their hoodies on, and they weren't smoking and fighting, and they were really nice. And I was very impressed. But to make it quickly, I fell in love by the first day I was there. I fell in love with these patients, and that has been my life practice.
Now, you told me about something that happened to you. You got ill. You became ill, right?
About 11 years ago, I felt a little pain in my spine, and I ignored it like most people do.
And
For
especially
another,
men.
especially men, and especially physicians. Ignored it for 3 months, and I felt it again and ignored it for another three. And finally, I went to my primary care physician, and he took some x-rays. He said, listen, you need to stop working right now because you are compressed. Your spinal column, your spinal cord is being compressed.
Wow. I just want to mention that you are married and you have 3 sons.
I'm married,
And
my wife, and I have 3 very good sons.
Okay, I wanted to put that in because how did your wife take this?
She took it in stride actually because it didn't start out as something very severe.
Well, when
but
they
as
say
time,
your spinal cord,
my spinal, yes, but you know, she knows I will take care of it supposedly. Uh, as time went on, it got worse and worse and unbearable actually.
were you able to walk?
At one point, if you had given me $1 million and put it on a car maybe 20 feet away and say go and pick that $1 million up, I would have to say, Miss Perryman, you get it and I'll give you half because I couldn't walk that far.
I would crawl.
I couldn't crawl, I couldn't walk. It was that unbearable.
Okay.
I eventually had 2 back surgeries, a hip replacement, a pain stimulator placed directly into my spine. I had hernia surgery, prostate surgery. Everything in my life just started cascading, getting worse and worse and worse until my very last surgery.
Wow. So you had a lot of surgeries and everything.
6 surgeries.
What did they say with the back? How did that happen?
Well, I was very athletic as a young man, and most people probably don't even understand, but most athletes and most active people, as they get older, they suffer the most from these injuries.
Right, right. Well, they found that out, especially from the football players
Exactly.
and so forth.
Exactly.
And so, any time did they tell you you may not make it?
They didn't particularly tell me I'm not going to make it, but I would say after about 7 years of chronic pain, felt that I was not going to make it. I actually became very depressed to the point I was actually suicidal.
Really?
Very, yes. I went to my guest room, unbeknownst to my wife and kids, one night, and I started to pray. And I said, God, I've had a good life. My kids are grown. They're doing well. My wife is fine. I have good insurance. She'll do even better when I'm gone. And I said, listen, I don't want to be here anymore. Take me out of here. I'm done. Planet Earth is over for me as you know it. And God answered me just as you are speaking with me right now, as clearly as you are speaking, and said, no, I'm not done with you yet. I got some stuff for you to do. And I answered him as clearly as he spoke to me and says, I'm not doing anything for you. I am done with you too. And
Well, did you take anything there in the room with you to end this life, or you just wanted God to strike you down?
I took nothing with me. I just wanted him to let me go easy in my sleep.
Oh, okay.
And he said, I have something for you to do, and you are going to be totally better again. And at this point, I was like, I've been sick for 7 years already. I've had 5 surgeries. You haven't made me better. What make you think now you're going to make me better? And he said, you will be better. Call this particular doctor that I'm going to tell you his name. And after a long struggle, I called the doctor, went and see him. It's a doctor that I was familiar with that I didn't really like at all. The last time I saw him, he and I had some words. And he said, "Why are you here? I didn't expect to see you again." And I said, didn't come by myself. Someone told me to come here. And he said, "Okay, we can do this surgery in 2 days." And we did the surgery. 3 hours, 4 hours after recovery, I was walking the entire length of Beaumont Hospital
Oh, wow.
hallway, back and forth, without a cane, without a walker, without a wheelchair, without a crutch. So this is something I have not done in almost 8 years. So I'm
Oh.
blessed to be here. Today I can dance. If you all want to see, I can show you. But I can do many things. I don't use any kind of walking ambulatory aids at all. But God did ask
what
me.
was the surgery? I gotta know.
It was a laminectomy, but it was
I had a
it depends on who. It really depends on who is doing your surgery. But the thing that struck me was what God asked me to do. He says, "You have to do something for me." And I said, "I'm not doing anything." This is before the surgery. I said, "I'm not doing anything for you." He said, "I just need you to do one thing for me for the rest of your life." And I said, "Okay, what is that?" He said, "I don't want you to be the doctor anymore. I want you to show people how to access medical care." At this time, President Barack was just trying to get his medical plan through, his affordable care. And he says, "You can help him, you can help the people that you know, and show them how to access medical care." And I'm struggling. I struggled for about 3 years trying to figure out what did he mean by that. And I actually know exactly what he means by that now, because another friend and I started a company. The name of the company is called Executive Exams, and we started it based on what God had asked me to do and new science today.
And with executive exams, would you tell them what the machine does?
Yes, we have a very computerized, high-tech machine that can do a lot of diagnostic things. And what we diagnose most of the times is what our people struggle with so badly. It's the cardiac metabolic risk syndrome. And that involves heart problems, it involves obesity, and it involves diabetes all at once. And with our machine, we can detect very early stages and signs and before signs and symptoms. We can detect early stages of these three disorders, and we can actually detect it 5 to 10 years before you have the first symptom.
Really? How do people get that? How do they get to access this machine? And then some people may not want to know.
You know, I understand about people not wanting to know, because I know for one thing, when it was my turn to be tested, I delayed it for almost a month.
Really?
Because I didn't want to, I wanted to know, but I really was afraid. I was afraid.
Fear.
And because, first of all, I just had all these things wrong with me. What else am I going to find? I really don't want to know. But the good thing about it is not to find out things that's going wrong with you to scare you. It's finding out things early enough before it starts developing to the stage that's causing damage. For instance, we can detect diabetes coming 10 years before you get it. We can circumvent you ever getting diabetes. We can go around the diabetes by changing your lifestyle.
So how does this machine work?
Well, it works. It's very, very technical, but it works on the electrical waves of your body, just like an EKG, like an EEG, like an ultrasound. It works on the waves of your body. You have current going through your body, and we can actually pick up from your sweat, just like a lie detector. We can pick up a lot of information about your brain just from your sweat. We can pick up from your waves, electrical waves. We can pick up a lot of things about your heart and the way your system works. So it's very technical. We are actually setting up shop where we can invite patients to come in with a doctor's prescription, or we actually have our own doctors that's working with us. That
So
will
is it
prescribe.
covered by?
It's fully covered by every insurance.
Really?
Every insurance covers it. And it's a way for us to really practice in this country preventative health. You know, we spend 10 times more per capita on a patient than the second leading country. And we are number 37th, right behind Costa Rica, a third world
Wow.
country in quality health.
First,
So-
Maurice tells us how we're 30 something in the country of education. We're low in health care.
We are very bad in healthcare.
Oh, my
We
gosh.
can take care of you after you get sick, but
We are
we don't
jacked.
try to we don't try to prevent you from getting sick, and that is our
Well,
problem.
preventative medicine is really one of the things about the Affordable Care Act.
It is
They want you-
mandated that we start practicing preventative care.
Oh, I'd like to say
Yes.
this to the audience. This afternoon, I have an interview. I interviewed Valerie Jarrett, who's an advisor to President Obama. She called in from the White House, and we did an interview here at the station. So we're going to play that on my 1 o'clock show today.
good.
So we were talking about the Affordable Care Act and
Excellent.
everything, but preventative medicine. And see, a lot of times doctors, throughout the years did not talk about preventative. They just,
Well, the truth is, and there lies the name of our company, Executive Exams. We have had preventative care in this country for the extremely wealthy. The CEO of the top companies, they get a battery of tests every year that can tell them, the doctor have so much information and can tell them what's going on for the next year. The common man now is not privy to this. It may cost as much as $12,000 for this test. We can't afford this, but with your insurance and just a couple of dollars, you can now get this test through us with the same and even more information than what they had before.
Brother Jeff is on the line.
Go ahead, Brother Jeff.
Good morning again, Mrs. Spearman.
Hi.
Good morning to your guests.
How are you doing?
Mrs. Spearman,
Yes.
we are what we eat.
Yes, that's
And the 99 element that makes the earth what makes our body. We have 9 systems. Our blood makes a cycle 8 minutes and 20 seconds, exactly the same amount of time that the sunlight coming from the sun, which is 93 million miles away, 8 minutes and 20 seconds. Our body is 75% water, and basically the earth is 75% water. They coincide with one another. But, Mrs. Spearman, we live in a society where just about anything that we intake today has some type of chemical that actually has a side effect to our bodies. In the very foods, until we start growing our own foods again, properly understand, our health will continue, to dwindle or whatever. When you talk about vaccination, from the time that a child comes to the world, they vaccinate. When you go do the research on vaccinations and whatnot, you'll find there's a book out called Death by Inoculation. You'll find that this is all being staged, that folks are making billions and trillions of dollars at the expense of the people in America, whatever. There's a tribe in the Himalayas right now today, and the average age is 150. Yet they don't live the way we live. They have women over there in their 80s that are still producing children. And so, as far as when it comes to as far as this health thing,
No, I don't want
look
no
at
more
look
kids.
at what you're eating today. Look at your ingredients on a package. You need a chemistry book or some type of book dealing with what you are ingesting or whatever. You need a chemical book or whatever.
Yeah,
and so a lot
that's
of our
true.
health problem is due to what we eat, what we drink, and how we think today.
Right, I agree with you. Thank you, Brother Jeff.
I agree with him on that. On the part where he said, "What we are, what we eat." It is so true.
And I'd like to do a documentary on those people who are
So would I.
150. I mean, women having babies at 80.
Interesting.
I'm wondering how does that happen? But anyway,
Interesting.
so Dr. Griffiths, what number can they call to inquire about executive exams?
Well, we have a clinic we just opened. Is the number there is 313-342-5187 and 313-377-0400. Those 2 numbers will get you in touch with the company. We also have an email.
And you have an email.
We have an email. It's executiveexamsnow@gmail.com.
executiveexamsnow@gmail.com. And I'm going to go back real quick to what Brother Jeff was saying, our food. That's why so many of these, like Trader Joe's and Whole Foods and everything, because they have a tendency, they say, not to put any preservatives.
You know, we are what we eat is exactly right. And I'll tell you a story. When I came here from Trinidad, I was a little boy, and I remember my father giving us a can of fruit. And I'm telling you, it took me the next 5 years trying to figure out how man put fruit in a can. And it did not rot.
Right.
Because prior to coming here,
Right.
I had never seen anything edible in a can in my life.
That is
Everything
true.
I ate, we grew. And it was a puzzlement to me. So as I grew and as I got older and wiser, I realized all of the preservatives that they put in it is what keeps it alive.
Right.
It's unbelievable.
And that is scary.
And that has to be scary.
And our children are getting that too, and so forth. So we have to educate ourselves in our community also of the good things to do, the things to do and not to do. It's so convenient to get convenience foods,
It is.
but like they did with that hamburger from McDonald's or whatever, it just sat there for a year. It looked the same. It looked the same. So
Exactly.
this has been really an education, and I really appreciate you coming. This is something.
Well,
So how's it going? How are the people taking this right now? Do you tell them what they have, or the doctor tells them?
I am the CEO of
Yeah.
the company, so I am not acting as their doctor.
Right.
But we have a physician that will discuss their results with them and let them know. And you know what's important about this particular exam and this test is not just finding out things that's coming or what's wrong with you, but it's finding out the optimal way to advance or to manage it before it causes problems.
Absolutely.
The treatment and the management is the most important.
So that's Executive Exams, 313-377-0400. And it's a new company, and I don't know if I'm kind of fearful myself.
We will do one of these exams on you, Brenda, and we will only tell you the stuff we know you can handle.
Tell me the good stuff, like I live to 150.
Well, you know, it is great when you find out, like in my case, I found out everything was just perfect. Everything was good.
Really?
Everything was good. But I found out with another person that we had examined that she will be getting diabetes in about 5 to 10 years.
Right.
She never knew about this, and that was the only thing that showed up on her test.
Okay.
However, the following day, her diet was changed and her lifestyle started changing. So she will now never get it.
Wow. Well, ladies and gentlemen, I'd like to thank Dr. Griffith, like to thank
my
Maurice
pleasure.
Morton, and we've had a wonderful, really informative morning today. And I want you to join me again at 1 o'clock for Table Talk with Brenda Perryman. And we will see you then. And then you'll see the interview with Valerie Jarrett will be on there too. So thank you, and I'll see you later.
Great.